evening, everyone. I'm Tony Shi, President of United Hospital Fund, and I am pleased to welcome you to UHF's first ever virtual gala. While I very much wish we were gathered in person, I'm thrilled and grateful that you have all joined us for tonight's event. The past 7 months have been an extraordinarily challenging time. The COVID-19 pandemic has touched every aspect of our lives and challenged our region's healthcare system as never before in modern history. Not surprisingly, we have seen the great strengths and remarkable commitment of our healthcare workforce. Tonight, we'll pay tribute to our healthcare workforce, and we will also present our 3 signature United Hospital Fund awards, recognizing exceptional leadership to improve health and healthcare. Each is an inspiring story. To tell you more about what we have planned, let me introduce John Simons, Chair of United Hospital Fund's board and tonight's gala chair.
Thank you, Tony, and good evening all. We do indeed have a great night ahead. Our tribute to our region's healthcare heroes in gratitude for their brave and invaluable service during the pandemic will feature a special performance by Tony Award-winning Broadway legend Brian Stokes Mitchell. And we will honor Roger Ferguson with our Healthcare Leadership Award, Neil Blumenthal and Dave Gilboa with the Distinguished Community Service Award, and Stephen and Constance Lieber with a special tribute. This evening's event is an important fundraiser to support United Hospital Fund and our work to build a more effective healthcare system, especially for those who are disadvantaged. So at several points during the evening, we'll project on the screen how you can support UHF with a personal donation. I'm very pleased to acknowledge those who have already generously supported tonight's gala. Please take a moment to look through tonight's program, which lists our many very generous supporters. I would like to single out just a few. The underwriter of the 2020 Distinguished Community Service Award is TIAA. Let me also acknowledge John and Marion Castle. For the past 35 years, they have generously provided the flowers for the tables at our galas. This year, they have generously provided virtual flowers by underwriting tonight's event production, and we are very grateful. The support of each and every one of you and all those represented in the program is greatly appreciated. So thank you all, and I hope you will enjoy the special evening we have planned for you. And here's our website address for those of you who would like to make a donation tonight. Now back to Tony, who will say just a few words about UHF's important work.
Thanks, John. United Hospital Fund has a long and proud history as a catalyst for positive change in our healthcare system. From our beginnings in 1879, we have focused on the needs of New Yorkers facing the greatest barriers to high-quality healthcare and optimal health. Today, our work tackles 3 central challenges. First, insurance coverage and access to care. Just before the pandemic hit, there were already more than 1 million New Yorkers uninsured, and countless others, even with insurance, struggled to pay medical bills. Now the economic downturn has led to an estimated 1.4 million New Yorkers losing their job-based health coverage, putting them at risk when coverage is needed most. UHF's independent analysis and program initiatives support efforts to achieve universal, affordable, and comprehensive health insurance coverage and access to care. Second, quality of care. Although we are fortunate to have some of the best healthcare providers in the world here in Greater New York, We all recognize that we must relentlessly continue to improve quality. UHF, with our healthcare partners, spread best practices, train doctors, nurses, and other healthcare professionals to be quality improvement leaders, enhance quality measurement and reporting, and work to better engage and support patients and their families. And the third focus area for UHF is clinical community partnerships. It's very clear that social and economic stressors, such as inadequate housing, poor nutrition, unemployment, and poverty, greatly affect an individual's health status. But the pandemic has brought this truth home in the most heart-wrenching way. Our work is fostering collaborations between the healthcare system and the community to address these social determinants of health and to address the unacceptable inequities that are driving health disparities among Black and brown communities. One important initiative is strengthening partnerships between pediatricians and community agencies to address families' unmet social needs. Perhaps the best way to understand the impact of our work is to hear directly from a few of those we work with.
I've worked with the United Hospital Fund for more than 15 years in a variety of roles for Governor Spitzer, Patterson, and Cuomo. Jim Talon played a critical role in shaping the health policy of Governor Spitzer and Patterson, which Governor Cuomo has built on in developing his own ambitious healthcare agenda. Tony Hsieh has proved a worthy successor to Jim Talon, which is saying a great deal. Tony's been a valuable counselor to me during his tenure at UHF, and I always welcome his advice. What makes the UHF an indispensable policy resource for the state is that their work is practical and focused specifically on New York. That makes their work more actionable than many health policy researchers whose work we see. I regret we can't all be together at this year's Gala, but I know that the work of UHF will never be more important than in the coming years as the healthcare system adapts to the enormous changes brought about by the COVID crisis. I want to thank the staff and the board of the United Hospital Fund for all the great work that you do.
Even before COVID-19, the Health Foundation knew that there was a problem with healthcare coverage in Western and Central New York. Therefore, we turned to the United Hospital Fund to conduct the needed research and to compile the real-life stories so that we could better understand the barriers to healthcare. The resulting 5% report helped the foundation build its reputation on being a committed organization in working with others in closing the gap in healthcare coverage. Therefore, we are deeply grateful to the United Hospital Fund for being one of our very first advocacy partners. We look forward to our continued collaboration and wish you great success in your gala. Thank you.
The UHF Clinical Quality Fellowship Program is a great resource for us, providing our rising stars the training in clinical leadership as well as quality improvement to build their knowledge, their skills, and their tools that are not taught in medical school and nursing school. We take full advantage of this. At the end of this year, more than 45 health and hospitals, doctors and nurses will have completed the Clinical Quality Fellowship Program. They come back energized and ready to immediately improve the quality and safety of the care that we provide at H&H. The greatest beneficiaries are our system, our staff, as well as the patients. Thank you, UHF.
In 2017, I had the opportunity to receive a grant from the United Hospital Fund, which focused on building working partnerships between pediatric practices and community-based social service agencies to ensure that young children get the healthy start that they deserve. In particular, this was exciting because we were just learning as physicians that social and economic factors like food insecurity, unsafe housing, unemployment were things that we needed to invest in order to ensure that our children, our clients, and our families had the best start. And through this project over the past 3 years, we've had a huge impact on tons of marginalized families. And actually, this whole experience led by United Hospital Fund led me and two other physicians, Doctors Nicole and Suzette Brown, to build on that model by creating Strong Children Wellness, which actually does a reverse integration, and it brings physical health services into community-based social service agencies to provide a one-stop shop to meet families' unmet medical, social, and behavioral health needs. It's exciting, and I'm proud to say that United Hospital Fund paved the way.
Paul, Nora, Eric, and Omalara, thank you so much. We are proud to be your partners in such important work. In each of our 3 focus areas, we depend on and collaborate with partners, including so many of you watching tonight, and we deeply appreciate your involvement with us. To learn more about our work, I hope you'll visit our website.
Moving now to the tribute portion of our evening, we begin with a salute to our healthcare workforce, our healthcare heroes who met the daunting challenge of the COVID-19 pandemic with compassion and bravery. During the peak of COVID-19 this past spring, while many sheltered in place with our lives on pause, our essential doctors, nurses, respiratory therapists, social workers, and housekeeping staff, and so many others, dug deep within themselves and showed complete dedication to their patients and our community. They, many of you watching, showed the world what it meant to be New York caring and New York tough.
To pay tribute to our healthcare heroes, we are honored to have a special performance by Brian Stokes Mitchell, one of Broadway's leading men, a Tony Award winner for Kiss Me Kate, and nominee for his performances in Ragtime and Man of La Mancha. This past April, after recovering from COVID-19, Stokes added to his legendary status by singing a message of hope and gratitude to the city's essential workers, particularly the medical professionals on the front line, at 7 p.m. each night from his apartment balcony on the Upper West Side. This was his way of keeping spirits up and sharing his special talents with New York during our darkest days. Throngs congregated each night to hear him sing The Impossible Dream until the crowds got so big that the evening performances had to end to keep everyone safe. But the media carried his voice across the city and even the country. Tonight, Stokes will share his full baritone with all of us with a special message of appreciation to New York's healthcare workforce.
Thank you, Tony, and thank you, United Hospital Fund. I am so pleased to be on the stage singing for you tonight in many ways, and I have hospital and healthcare workers to be grateful for my being here tonight as well. And I'm certainly grateful to all of you who are doing everything that you have been doing to keep New Yorkers going and comforting the dying and helping the sick and helping people get better. And we are so grateful. All of New York is so grateful for everything that you have done and have continued to do. The song I'm going to sing is the song that I was singing out the window, actually. And I realize that probably most of you were otherwise engaged, so we're not able to see it. So I'm going to do it especially for you tonight. Every night when I was singing it, I was singing in my heart for all of you. And now I get to actually sing it for you. So I'm very, very pleased to be able to do this song. The song is called The Impossible Dream, but the actual title is called The Quest. And it's the perfect song, I think, to sing. And it's one of the reasons why I sang this particular song, because it's a lot of people think it's about trying to do the impossible. And it's not. It's actually about trying, period. And we can't do anything until we first try. And all of you have been doing an amazing job, not only trying, but succeeding as well. So I dedicate this song to all of you with great, great gratitude in my heart. And also my thanks to Ted Firth, who was on piano with me. To dream the impossible dream, to fight the unbeatable foe, to bear with unbearable sorrow, to run where the brave dare not go, to right the unrightable wrong, to love pure and chaste from afar to try when your arms are too weary to reach the unreachable star. This is my quest, to follow that star, no matter how hopeless, no matter how far, to fight for the right without question or pause, to be willing to march into hell for a heavenly cause. And I know if I'll only be true to this glorious quest, that my heart will lie peaceful and calm when I'm laid to my rest, and the world will be better for this. That one man, scorned and covered with scars, still strove with his last ounce of courage to reach the unreachable stars. This is my quest, to follow that star, no matter how hopeless, no matter how far, to fight for the right without question or pause, to be willing to march into hell for a heavenly cause. And I know if I'll only be true to this glorious quest, that my heart will lie peaceful and calm when I'm laid to my rest, and the world will be better for this. That one man, scorned and covered with scars, still strove with his last ounce of courage to reach the unreachable star.
What an incredible voice. Thank you so much, Stokes, for that beautiful performance and its special meaning as we pay tribute to our healthcare workforce. We will have the pleasure of hearing one more song from Brian Stokes Mitchell at the end of tonight's program, so stay tuned. Moving now to the awards portion of our evening, UHF annually presents 3 awards at our gala to shine a spotlight on individuals who are improving health and healthcare. The first award is the Healthcare Leadership Award. I'm very pleased to present this award to Roger W. Ferguson, Jr., President and CEO of TIAA, the nation's largest provider of financial and retirement services to the nonprofit sector. This Fortune 100 company serves some 5 million active and retired employees at more than 15,000 nonprofit organizations. Healthcare is one of TIAA's largest and most important client sectors, and it has been carefully stewarded and expanded under Roger's leadership over the past 12 years. Employees working at more than 1,400 healthcare institutions entrust their financial well-being to TIAA, and the TIAA Bank provides critical financing for healthcare real estate projects in New York and across the country. While Roger's illustrious career spans both the public and private sectors at the highest levels, his abiding commitment to service and healthcare was nurtured by his aunt, Dr. Angela Ferguson. Dr. Ferguson, now 95 and matriarch of the family, received her medical degree from Howard University in the 1940s. She became a pediatrician, developed a groundbreaking blood test that could detect sickle cell anemia at birth, and helped establish Howard University Hospital. Like his aunt, Roger is a force for good, with stellar credentials and rock-solid values. After receiving a bachelor's degree, law degree, and PhD in economics, all from Harvard, Roger worked for top law and consulting firms, was appointed to the Board of Governors of the Federal Reserve System, and served as its vice chairman from 1999 to 2006. Before taking the helm at TIAA, he was the head of financial services at Swiss Re and later served on President Obama's Economic Recovery Board. At TIAA, Roger is known as a visionary and steady leader. Embracing and furthering the company's commitment to diversity and inclusion has been a priority. As a child, Roger attended a segregated elementary school and received scholarships to high school and later Harvard. He says he sees himself as a beneficiary of those who fought for civil rights and has made a personal commitment to give back, philanthropically and through service. For more than a decade, Roger has served on the board of Memorial Sloan Kettering. The United Hospital Fund is extremely grateful for our long and productive relationship. For the past 15 years, TIAA has provided underwriting support for our Distinguished Community Service Award to honor individuals whose voluntary leadership is improving health and healthcare. And we jointly sponsor the Healthcare Leadership Roundtable, bringing together hospital and healthcare leaders from across the region annually for frank discussion of issues and concerns. Roger, you are an inspiring leader and individual. We thank you for your extraordinary contributions to our country and to New York, and for your special commitment to healthcare and the healthcare workforce. UHF is very proud to present you with the Healthcare Leadership Award.
Thank you, Tony, for those kind words, and thank you to United Hospital Fund for honoring me with the Healthcare Leadership Award. I am truly grateful to be recognized in this way by an organization that I admire so much. It's been a privilege for me as TIAA CEO to partner closely with UHF over the past 12 years. Throughout that time, my respect for its work has only continued to grow. As UHF pursues its inspirational mission of enhancing the healthcare system for all New Yorkers, it is making a difference in countless lives. TIAA is also a mission-driven organization. We were founded more than 100 years ago to serve people and institutions dedicated to making a difference in the world through their work. Given our company's purpose, it's only natural that healthcare has become such an important part of our business. We are proud to serve those who dedicate their lives to the health and well-being of others, and we are committed to helping them achieve the financially secure retirements that they so richly deserve. As Tony mentioned, the seeds of my personal interest in healthcare were planted a long time ago, thanks to the influence of my aunt, Angela D. Ferguson. She has always been a powerful example to me of how much healthcare, medical education, and medical research all matter. Today, as the world struggles to navigate the COVID-19 pandemic, the importance of healthcare, research, and delivery are all more important than ever. The New York area healthcare community has inspired us all with its dedication to patients and courage in the face of so much uncertainty. I'm honored to be able to play even a small role in helping ensure the strength of this community, which is so vital in turn to the strength and vitality of the entire region, and indeed to the health and well-being of all of its citizens. Thank you for the opportunity to be of service, and thank you again to UHF for recognizing me with this award. Thank you very much.
Congratulations, Roger. Our next award this evening is the Distinguished Community Service Award. This award recognizes voluntary leadership of a specific initiative responding to important healthcare needs. This is the 15th year that TIAA has been the underwriter of this award, and we greatly appreciate their generous support. So I will turn things back to Roger Ferguson to introduce the recipients of this year's award.
I'm pleased to present the 2020 Distinguished Community Service Award to Neil Blumenthal and Dave Gilboa, co-founders and co-CEOs of New York-based eyewear brand Warby Parker. in recognition of their work to provide underserved New York City school children with free vision screenings, eye exams, and eyeglasses. As someone who grew up wearing eyeglasses, I know firsthand their importance to reading, learning, working, and ultimately to success in life. Neil and David Wunderkins, brilliant and creative entrepreneurs who, from the very start, believed in using business to do good. In 2010, they, along with Andy Hunt and Jeff Rader, two fellow MBA candidates from the University of Pennsylvania's Wharton School of Business, conceived the then radical idea of selling glasses online and at a revolutionary price directly to consumers. Neil and Dave also wanted to help the 2.5 billion people around the world who need glasses yet can't afford them. They came up with a simple yet powerful idea: buy a pair, give a pair. Since the company's inception, for every pair of Warby Parker glasses purchased, a pair of glasses is distributed to someone in need. To date, more than 7 million pairs have been distributed. In 2015, their charitable efforts turned to New York City school children with the launch of Pupils Project, a public-private partnership between Warby Parker and the City of New York to provide free vision screenings, eye exams, and glasses to students in community schools. Around a quarter of New York's 1.1 million school children have some kind of vision impairment, but on average, only 5% of low-income students who need them have eyeglasses. Pupils Project has since expanded to serve not only New York's 267 community schools, but also all kindergartners and first graders across the city. It also serves schools in Baltimore and Philadelphia and is expanding to Boston and Washington, D.C. This program is radically transforming these children's academic, social, and future economic potential. But rather than having me tell you, let's go to a video so you can see for yourselves the impact. It is now my honor to present Neil Blumenthal and Dave Gilboa with the United Hospital Fund's 2020 Distinguished Community Service Award.
We want to start by thanking the United Hospital Fund for this honor and congratulating Roger on being recognized for all that TIAA does to service the financial needs of those in the academic, government, medical, and other nonprofit fields. Neil and I, along with our co-founders, Andy and Jeff, started Warby Parker to transform the eyewear industry and prove that for-profit businesses could not only scale, but do so while making a positive impact on the world. A major part of our efforts have focused on what the CDC calls the single most prevalent disabling condition amongst children in the United States, lack of access to vision care, a problem that is exacerbated in low-income areas. Pupils Project has been built in an iterative fashion. To understand and address the lack of routine vision care in high-poverty schools, we initially had Warby Parker employees volunteer to set up single-day clinics in 6 schools around New York City. Through this pilot, we collected data that validated the magnitude of the problem and generated ideas on how we could create a solution. Vision disability is a massive issue that has not gotten enough attention. We estimate that in New York City alone, there are 200,000 children in public schools who need glasses but don't have access to them. Many of these kids end up being misdiagnosed with unrelated conditions, become disengaged in school, can't effectively learn, and can't effectively develop into their full potential. We recognize that this problem exists in our own backyard, and we're working our best to solve it. With that, I'll hand it over to Neil to elaborate on who in our community has made Pupils Project possible.
It's truly been a team effort, leveraging the talent and the resources we have at Warby Parker, which consists of some of the most highly engaged, social-minded people out there who are really driven by creating lasting impact. Beyond having dozens of employees volunteer to help during vision days at local schools, we've leveraged Warby Parker's unique set of skill sets and relationships. For example, our supply chain team has worked with world-class factories to produce high-quality but low-cost glasses. Our tech team has built the infrastructure to process orders from schools. And perhaps most importantly, our in-house designers have dreamt up frames that kids are excited to wear. Regardless of age, style matters, and we believe that every child should have the dignity to have a pair of glasses that instill confidence. Of course, none of this would be possible without the amazing public and private partners who make this program happen, including the New York City Office of School Health, the Department of Education, the Department of Health and Mental Hygiene, the Mayor's Fund, Helen Keller International, Robin Hood, the Gray Foundation, Jonas Philanthropies, Katrina Van Dan Hevel. This is truly a partnership, and one that we hope can be used to tackle other challenges. Right? We work best when we're all leveraging our expertise to bring out social good, and we hope that this is a program that can inspire others to do the same. We are so proud to do this work and so honored to be recognized in this way by the United Hospital Fund. Thank you so much.
Congratulations, Neil and Dave. Our final award this evening is a special tribute to the late Stephen and Constance Lieber. We honor the Liebers posthumously for their visionary philanthropy to advance scientific research and treatment to improve the lives of those with mental illness. In 1986, at a Columbia University symposium on mental health, an unassuming couple approached Dr. Herbert Pardes, who was then the head of Columbia's psychiatry department. They said, "We'd like to do something for mental health." Little did Dr. Pardes know that the brief encounter with Stephen and Constance Lieber would ultimately spur major advances in scientific research on mental illness and would literally transform the field. The Lieber's daughter has schizophrenia, and they wanted to help her and other families facing mental illness. Dr. Pardes introduced them to the National Alliance for Research on Schizophrenia and Depression, which is now the Brain and Behavioral Research Foundation. Connie served as the foundation's president for 18 years, and Steve, an investment banker, was its chairman for 12 years. The Lieber's leadership, philanthropy, fundraising, and compassionate approach to patient care have turned the foundation, now led by Dr. Jeffrey Borenstein, into a powerhouse and the world's most prominent private funder of mental health research grants. Since 1987, the organization has awarded more than $408 million in grants to more than 4,800 scientists around the world, spurring discovery, fostering new levels of awareness, and helping to lessen stigma. Several principles guided the Lieber's extraordinary work. They insisted that the research funding decisions should be made solely by the scientific experts. They strongly believed in encouraging promising researchers to enter the field, resulting in many groundbreaking careers in psychiatric research. And they created sought-after awards to recognize noteworthy researchers and humanitarians, building reputations and respect for their work. And the Liebers were equally committed to offering solace and advice to families in need of help dealing with the illness of their loved one. In 2011, in partnership with the Maltz family, the Liebers created a new institute and research laboratory at the Johns Hopkins Medical Campus. The Liebers also founded the Lieber Recovery and Rehabilitation Clinic and the Lieber Center for Schizophrenia Research and Treatment at Columbia University, all of which are renowned for their work. Connie Lieber died in 2016, and Steve died in March of this year. Their legacy of extraordinary generosity and commitment to improving the lives of those with mental illness most certainly lives on. Dr. Herbert Pardes, Executive Vice Chairman of New York Presbyterian Hospitals Board, President of the Brain and Behavioral Research Foundation Scientific Council, and a dear friend of the Liebers, will accept this special tribute on their behalf.
We celebrate tonight two magnificent leaders, models for all of us. When they learned they had to care for their lovely daughter, Janice, the Liebers took on that challenge with gusto and maximum sensitivity. Janice prospered. This example characterizes their relationships with patients, families, scientists, in other words, virtually all groups affected by mental illness or doing work on mental illness. To pursue their goal of defeating mental illness, they gave all their energy and the bulk of their resources. And for those of us who work to overcome these illnesses, the Liebers were like best parents, openly receptive, looking everywhere for answers, focusing on excellence, and in the vernacular, putting the money where their mouth is. Mental illness is one of the most, if not the most frequent sickness affecting people all over the world. Many people are reluctant to have it known that mental illness exists in their families. But countless people found the Liebers understanding, empathic, helpful. They made people feel they were on their side. As wise leaders, they made Brain and Behavior Research Foundation function in an exemplary way. They contributed money to cover all the administrative expenses so we could say to a prospective donor, every dollar you give means a whole dollar for research. They promoted warmth, caring to the BBRF staff, led by a wonderful president, Jeff Bornstein, as well as an outstanding team at the Lieber Research Institute at Johns Hopkins, directed by Dan Weinberger. We're delighted by the selection of Jeff Simon, Steve's nephew, as our new chair of the BBRF board. They established the Pardes Humanitarian Award given to international leaders who were mental health icons and also impactful contributors to society. To fully describe the Liebers, I want to emphasize their disinterest in praise for themselves. They exulted in others' success. On the day Connie passed, Steve and I were with her in her hospital room. This seriously ill, dying woman chose to say, "You know, Herb, the doctors and nurses are wonderful here." To the last, Connie and Steve thought of others. When we asked Steve to be honored, he agreed only when a change was made to honor them both. I love them both. To the end, this selfless couple thought of others and each other. All who know them love them and will continue to love them forever. I'm greatly honored to accept this tribute in their memory and grateful to the United Hospital Fund for drawing attention to the spectacular work of the Liebers and that of the BBRF. Thank you very much.
Thank you, Herb. What wonderful honorees. We are both grateful and proud to have the opportunity to pay tribute to such exceptional individuals. Before we conclude tonight's gala, we have two special treats. New York's heroic healthcare workforce also has musical talent. We invited some of them to join us tonight, both to thank them and to be inspired by their message of courage and hope. Brian Stokes Mitchell will then offer a final song for all of us. Ladies and gentlemen, please enjoy this special musical performance sung by our own healthcare professionals representing Memorial Sloan Kettering Cancer Center, Montefiore Medical Center, New York Presbyterian, NYU Winthrop Hospital, SUNY Downstate Medical Center, Woodhull Hospital, Weill Cornell Medicine, and Yale New Haven Hospital.
You're broken down and tired
of living life on a merry-go-round.
You can find the fighter, but I see it in you, so we can walk it out.
Mountains, we gon' walk it out.
Mountains.
And I'll rise like the day.
I'll rise up, I'll rise unafraid. I'll rise up, and I'll do it 1,000 times again.
1,000 times again. For you, for you,
for you. All we need is hope, and for that we have each other.
After that we have each other. We have each other.
I'll rise like one day. I'll rise up in spite of the ache.
I will rise
1,000 times again.
and we'll rise up, rise like the waves. We'll rise up, and in spite of the ache, we'll rise up,
And I'll win 1,000 times again.
for you, for you, for you.
What an uplifting message and beautiful rendition. Thank you to those amazing singers who are also healthcare heroes. We are coming to the end of our evening, which Brian Stokes Mitchell will close with a special song for us. But first, I thank you so much for joining us. I want to again recognize tonight's distinguished honorees, Roger Ferguson, Neil Blumenthal and Dave Gilboa, and Stephen and Constance Lieber. Leaders who inspire all of us and remind us that even in times of challenge and crisis, there are beacons of hope in our wonderful city and region. And on that note, I wish you good night, and I introduce Stokes' final number that will conclude our evening, Wonderful World.
So this final song I'm going to sing for you tonight is probably my favorite song in the world. One of the reasons I love it is because it's so simple. It probably has less than 100 words in it, but like a good haiku poem, it creates an entire universe. Now what's interesting is it's a song that everybody knows. It was first done probably 70 years ago now, I think, maybe a little bit more. Now it seems to be an odd song to be singing, given all the strife that we are in now, not only politically and with social and racial justice, but also all of the problems with the pandemic as well. It seems like it's an odd song to sing, but for me, this is, I think, more of an aspirational song, and it still has an optimism and a sense of beauty about it that I really appreciated. And I particularly think it's appropriate because the title of the song talks about what all of you are doing right now and are making this place where we live. So again, thank you for all of your care, all of your work, all of your dedication, all of your sacrifice as well. And I and all of New York really appreciate you, and New Jersey as well, really appreciates the work that you are doing. And we wish you health and safety, and thank you for making this world a little bit more wonderful. So this song is dedicated to all of you. I see trees of green, red roses too. I see them bloom for me and for you, and I think to myself, what a wonderful world. I see skies of blue and clouds of white, the bright blessed day, the dark sacred night, and I think to myself, what a wonderful world. Colors of the rainbow, so pretty in the sky, are also on the faces of the people going by. I see friends shaking hands, saying, how do you do? They're really saying, I love you. I hear babies cry, I watch them grow. They'll learn much more than I'll ever know, and I think to myself, what a wonderful world. Colors of the rainbow, so pretty in the sky, are also on the faces of the people passing by. I see friends shaking hands, saying, how do you do? They're really saying, I love you. I hear babies cry, I watch them grow. They'll learn much more than I'll ever, ever, ever know. And I think to myself, what a wonderful world. And I think to myself, what a wonderful world. Thank you, everybody. God bless. Stay well. And thank you, Mr. Ted Firth.